here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So I think that's always been a big question. Should the school day start later? Does that mean they go later? What do you think?
You know, I mean, I think it's always going to be a question. I mean, I think as the segment indicated, it's a number of things. It's not just what time you go to sleep, but just that whole lifestyle issue that we talk about, you know, going to school an hour later. I think they would fill that space with something else and go to bed even later. So, I mean, I think it has to do with once they get home, get your work done, get to sleep, so that you can get your 7 to 8 hours a night. So many distractions out there with TV, video games, texting, emailing, etc., that a lot of times will keep them up. The parents are busy. They're just getting home from work as well. So it's a societal, cultural issue that we have to fight. And unfortunately, with all the distractions that we have, that's going to be very difficult. Even if you push it back to 8 a.m., I guarantee you they will find a reason to stay up an hour later and wake up even later the next morning. It's just an ongoing issue. Even when we were growing up, we never wanted to get up, even though we got a good 7 to 8 hours a night of sleep. You know, you just want to lay in bed nice and warm and just kind of do nothing. That's just, you know, being a teenager.
So 7 to 8 hours is typically the best amount of sleep that you can get?
Yeah, absolutely. That's average. And I know some people that I went to college with, they could function on 4 hours a night. Some people, yeah, some people need longer, but the average roughly is 7 to 8 hours, absolutely.
All right. And of course, eat well when you're going to school.
Yeah, eat well. You know, thinking about sleeping, all the energy drinks, Monster, a lot of caffeine, a lot of sugar, very stimulating. That normally will impair your ability to sleep. So again, even though class starts later, if you're drinking Monster drinks, that kind of defeats the purpose. And some of the other foods that have a lot of sugar, which are very stimulating, a lot of the snacks that we eat at night. So it's just not one thing. You got to look at the whole picture.
And what can you say as far as eating breakfast? How important is that going to school?
I personally believe in eating breakfast. However, that's a problem, again, for a lot of families. Time, crunch, etc. Who's going to cook it? How's it prepared? We talk a lot about processed food, fresh food. So it's a lot of questions that a lot of times go unanswered, unfortunately, in the morning. Everybody's so busy. But I personally believe in getting a good breakfast in the morning, a lot of fresh fruit, good whole grain breakfast, cereal, nuts, eggs are good for breakfast. It kind of sets the day for your appetite. A lot of times if you don't eat breakfast, you're famished. At lunchtime, you tend to gorge on the wrong things. So I think breakfast is important.
All right, on to some of our viewers' medical questions. This person says, does a sty bleed? I have something like a sty in my eye, and it started to bleed this morning while I was getting dressed. Should I be worried?
Yeah, I think it can. It's a small little eruption on the lower part of your lid or the upper part of your lid. Certainly can bleed. It's irritated typically, especially if you're rough with it. So just certainly keep pressure on it. And if it continues to bleed, get to your doctor maybe for a better evaluation.
Okay. I have endometriosis. I haven't started my monthly ever since June. I've been hurting a lot. What should I take for pain, and what can I do for it?
I think anytime pain or mild to moderate pain like that, we start with an anti-inflammatory such as Motrin, Advil. Tylenol works really well. You know, we're trying to stay away from the strong, potent medications such as tramadol and hydrocodone. So normally with any type of pain, we normally start off with those anti-inflammatories over the counter first.
And eventually, is she going to have to end up having surgery, do you think?
Just depends. Certainly a one-on-one conversation with the gynecologist. Sometimes medications are helpful, but certainly just that one-on-one conversation to get a whole picture of how bad it is for that patient.
All right. We've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person says, I have PCOS. The doctor has me on Riomet to help me with the symptoms, but I want to have a baby soon. Should I ask her to add a fertility pill also?
Yeah, absolutely. Polycystic ovarian syndrome, sometimes a cause of infertility for females. So sometimes, yes, you do need a fertility pill with that, as well as a medication called metformin to try and counteract the metabolic issues that are related to PCOS. No, you do not have to have cysts on your ovaries. It is a syndrome of hormonal imbalances, and so the gynecologist can help you deal with that by supplementing you with certain medications.
Okay. Are there any real side effects to having your tubes tied? Too many women, including myself, end up having their tubes tied and having several issues.
I think anytime you have a surgery, there's always a situation of risks and benefits, and that's a conversation you have prior to having the surgery. What are you looking for? What is this supposed to help you achieve with the surgery? So yeah, you can certainly always have complications, but it is a low-risk surgery compared to open heart surgery, brain surgery, maybe cancer surgery. So this is surgery that is normally done by gynecologists, obstetricians, very routine, but can never escape the issue of complications. So just have that conversation with the surgeon.
Okay. What are the signs and symptoms of osteoporosis?
For most people, there are no signs and symptoms. If you go to your general physician or your healthcare professional, a lot of times if you're 65 and above, we will do a screening test called a bone density test, which we do about every 12 to 18 months to determine if you do have that, especially if you are high risk, such as if you're on prednisone, if you have other certain medical problems which predispose you to osteoporosis. We will do a bone density test to figure that out. And if you do have osteoporosis, then there are an assortment of medications orally as well as IV that we can give you to help with that. Some people, however, are symptomatic. They just have a fracture. They're walking along and bam, they have a fracture. So because the bones get so brittle, you don't necessarily have to traumatize yourself. So this is called a spontaneous fracture versus a traumatic fracture. And that's normally when we'll do a bone density and find out they have osteoporosis. But we're up to speed with that. So most physicians are looking for it, screening for it, and getting patients on medication. But we do have a few that slip through the cracks.
Do you take like vitamin D to prevent getting osteoporosis?
You can. That is one of the components of treating osteoporosis, as well as a condition called osteopenia, which is leading up to full-blown osteoporosis. Calcium and vitamin D supplements twice a day typically. Get out, move, exercise, weight-bearing exercises, as well as a good healthy diet are also components of treating osteoporosis and preventing osteoporosis.
Okay. 59-year-old female, what causes one nostril to stop up?
Most of the time some sort of inflammation can cause that, or you may have nasal polyps or a deviated septum. So a lot of times we have to do a full examination, maybe a CAT scan of the sinuses, maybe referral to the ear, nose, and throat doctor. There are surgical procedures to relieve that, but a lot of times we'll start off with just a nose spray to relieve that. The mucous membranes become swollen from viruses, allergies, etc.
All right, Dr. Levine, as always, we appreciate you
Yes,
stopping by. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kfdm.com, or post those questions every Monday on our KFDM News Facebook page.